Namaskar. A warm welcome to World News and Indian Perspective on All India Radio. This is Renuka and with me is R.S. Raghu bringing glimpses of the major developments of the day from across the globe. Over the next half an hour, we shall bring you the latest from the world of politics, economy, sports, entertainment and more. The headlines. Prime Minister Narendra Modi assures full support to all the states in the fight against COVID-19. India intensifies efforts to distribute oxygen in the country. Air Force pressed into action. Oxygen generation plants to be imported from Germany. Japan declares state of emergency in Tokyo, Osaka regions to contain COVID-19 spike. India and the US announce Climate and Clean Energy Agenda 2030 partnership. Rescuers race against time as hunt for missing Indonesian submarine KRI Nanggala continues. NASA successfully launches Crew 2 to the International Space Station, and in IPL cricket, Punjab Kings take on Mumbai Indians in Chennai. As the number of COVID cases are on the rise again, we appeal to our listeners not to lower the guard, follow all the precautions, and all those above 45 years to get vaccinated without any hesitation. Stay safe and protected by following these 3 simple steps. Wear a face mask, maintain 2 gaz ki duri for social distancing, and focus on hand and face hygiene. And now the news in detail. Prime Minister Narendra Modi has assured centre's full support to all the states in the fight against COVID-19. Interacting with the chief ministers of 10 states and 1 union territory in a meeting to assess the COVID situation, especially in areas reporting high number of COVID cases, Mr. Modi stressed that if all the states work together as one nation, there will not be any scarcity of resources. The Prime Minister added that the Union Health Ministry is also in touch with the states and is monitoring the situation closely and issuing necessary advices to them from time to time. On the issue of oxygen supply, Mr. Modi took note of the points raised by the states. He said there is a continuous effort to increase its production and supply. He also highlighted that all the concerned departments and ministries of the government are working together to address the situation, adding that the industrial oxygen in the country has also been diverted to meet immediate requirements. The Prime Minister urged the states to check hoarding and black marketing of oxygen and medicines. He said that every state should ensure free movement of oxygen tankers and make sure that they do not get stopped or stranded. Mr. Modi urged the states to set up a high-level coordination committee to carry oxygen to different hospitals of the state. He added that such coordination committees should ensure that as soon as there is allotment of oxygen from the centre, it can deliver oxygen as per requirement in different hospitals of the state without delay. The Prime Minister stated that the centre is working on all possible options to reduce the travel time and turnaround time of oxygen tankers. In the same light, they highlighted the Oxygen Express initiative started by the Indian Railways and also cited the transportation of oxygen tankers by the Indian Air Force carriers to reduce the time lag of transportation of medical oxygen in the country. The Prime Minister also stressed on the need to scale up testing and continue with the vaccination drive amid the emerging situation. Highlighting few recent incidents of hospital mishaps, Mr. Modi urged for adherence to strict safety protocols. Addressing concerns of few participants, he asked the administration to continuously make people aware not to indulge in panic buying. Prime Minister Narendra Modi on Friday interacted with leading oxygen manufacturers across the country through video conferencing. He said this time is not only to deal with the challenges but also to provide solutions in a very short time. During the meeting, Mr. Modi stressed on the need to maintain good coordination between the government and the oxygen producers. The Prime Minister appreciated the oxygen producers for increasing their production in the last few weeks. He acknowledged the several steps taken to increase the production of liquid oxygen. He also thanked the industry for diverting industrial oxygen to meet medical requirements in the country. To improve the situation further, Mr. Modi spoke about utilizing the full potential of the industry to meet the demand of oxygen in the coming days. He noted that there is a need to increase the availability of oxygen cylinders as well as upgrade the logistics facility for transportation of oxygen. He urged the industry to utilize tankers meant to transport other gases for oxygen supply. The Prime Minister said, keeping in mind the requirements of the states pertaining to oxygen, the government is working on effective use of the railways and the Air Force so that the tankers reach the production centre as soon as possible.
The Indian Air Force has intensified its effort to distribute oxygen across the country. C-17 and IL-76 aircraft of Indian Air Force have started airlifting big oxygen tankers from their places of use to the filling stations. This move will help in easing the supply of oxygen amid the growing demands. Meanwhile, the Armed Forces Medical Services AFMS has decided to import oxygen generation plants and containers from Germany amid shortage of oxygen in the hospitals during the second wave of COVID-19. In a statement, Defense Ministry said that 23 mobile oxygen generation plants are being airlifted from Germany, which will be deployed in AFMS hospitals catering to COVID patients. These oxygen generating plants are expected to arrive in India within a week. Each plant has a capacity to produce 40 liters of oxygen per minute and 2,400 liters an hour. At this rate, it can cater to 20 to 25 patients round the clock. The advantage of these plants is that they are easily portable. In another important decision, Ministry of Defence is also giving extension to short service commissioned doctors in AFMS till 31st of December this year to tide over the current surge in medical services. The move will augment the strength of AFMS with 238 more doctors. Government of India on Friday said that 13,54,78,420 vaccine doses have been administered in the country till now. The Health Ministry said the country has reported 3,32,730 new COVID-19 cases in the last 24 hours. With this, the total cases have reached 1,62,63,695. The ministry said 1,93,279 people were discharged in the last 24 hours. Till now, 1,36,48,159 persons have been recovered from COVID-19. The recovery rate is now at 83.92%. Active cases in the country are 24,28,616. The Health Ministry informed that 2,263 deaths were reported in the last 24 hours and the death toll due to the pandemic has reached 1,86,920.
Only 3 months ahead of the Olympics, Japan has declared a state of emergency for Tokyo, Osaka, Kyoto and Hyogo from 25th of April after a recent surge in COVID-19 cases. Announcing the emergency till 11th of May, Prime Minister Yoshihide Suga said that the step is largely intended to be short and intensive. He said it is to stop people from travelling and spreading the virus during Japan's Golden Week holidays from late April through the first week of May. This is Japan's third state of emergency since the pandemic began and comes after a month of an earlier emergency in the Tokyo area. The measures include shutdown orders for bars, department stores, malls, theme parks, theatres and museums. Restaurants that do not serve alcohol and public transportation services are asked to close early. Schools will stay open, but the universities are asked to return to online classes. Mask wearing, staying home and other measures for the general public remain non-mandatory requests. This is All India Radio giving you the world news.
3 steps to stay protected and stay safe from COVID-19. Wear face mask, 2 gaz ki duri to maintain social distancing, maintain hand and face hygiene.
Prime Minister Narendra Modi has announced a US-India partnership on clean energy and climate change. Addressing Leaders Climate Summit, Mr. Modi announced launch of India-US Climate and Clean Energy Agenda 2030 partnership, which can be a template of green collaborations to help developing countries access to affordable green finance and clean technologies. Mr. Modi said, together we will help mobilize investments, demonstrate clean technologies and enable green collaborations, underlining that the concrete action is needed for humanity to combat climate change. He said, we need such action at a high speed on a large scale and with a global scope. Prime Minister said, India's ambitious renewable energy target of 450 gigawatts by 2030 shows our commitment, Mr. Modi said. Despite our development challenges, we have taken many bold steps on clean energy, energy efficiency, afforestation and biodiversity. Quoting Swami Vivekananda's words, arise, awake and stop not until the goal is reached, Prime Minister appealed to the world leaders to make this a decade of action against climate change. He also urged nations to adopt sustainable lifestyles and a guiding philosophy of back to basics as an important pillar of economic strategy for the post-COVID era. The India-US collaboration on clean energy is expected to play an important role in helping India fulfill its ambitious renewable energy goal of reaching 450 gigawatt by 2030. At the summit called by US President Joe Biden, several countries including the US, Japan and Canada announced their enhanced climate action plans to substantially cut their carbon footprints by 2030. Aim of the Leaders Summit is to galvanize efforts by the major economies to reduce greenhouse gas emission and meet the targets of the Paris Agreement to keep temperature rise to well below 2 degrees Celsius above pre-industrial levels by the end of the century. The hunt for a missing Indonesian submarine with 53 crew on board has reached a critical phase as the oxygen supply on board will be exhausted by Saturday afternoon. Contact was lost with the KRI Nanggala 402, a 44-year-old vessel on Wednesday during a torpedo drill with the head of Indonesian submarine fleet aboard. Rescue aircraft and ships have scoured the sea north of Bali, with more Navy ships leaving the Indonesian base of Banyuwangi early on Friday to head to the Bali Sea. Indian Navy on Thursday dispatched its Deep Submergence Rescue Vessel DSRV to assist Indonesian Navy in search and rescue efforts. India is among the few countries in the world capable of undertaking search and rescue of a disabled submarine through a DSRV. India's Navy's DSRV system can locate a submarine up to the depth of 1,000 meters utilizing its state-of-the-art side scan sonar and remotely operated vehicle. The German-built vessel KRI Nanggala is one of 5 submarines operated by Indonesia. It was made in the late 1970s and underwent a 2-year refit in South Korea that was completed in 2012.
In today's Hot Spot section, we are taking a closer look at the government's efforts to contain the second wave of COVID-19 pandemic. In conversation are Ashok Tandon, political analyst, and Ruchika Chitravanshi, journalist.
Good evening. We are meeting under very grim circumstances as the COVID cases in the country are rising in the second wave as never before. Today, the Prime Minister of India, Mr. Narendra Modi, has taken a meeting with Chief Ministers to understand what our preparation is, to understand the challenges and come up with solutions with regards to oxygen supply, the vaccine supply, etc. in the country. Mr. Ashok Tandon, can you first of all tell us what are the main takeaways from what the Prime Minister has said today in his meetings with the Chief Ministers?
In the midst of rising COVID-19 cases across the country, Prime Minister Narendra Modi has been holding a series of review meetings over the last few days. And in that context, he has been holding even internal review meetings with his own cabinet colleagues and the officials of the Prime Minister Office, Ministry of Health, Railways. And in that series, today, he held another review meeting with the Chief Ministers of states. 10 chief ministers participated in it, the states which are having very serious cases. And at the meeting with the chief minister, the Prime Minister's emphasis was on a very concerted and united effort on the part of all the states as well as the central government and the local bodies to overcome the situation. And if I may use his one-liner, which the Prime Minister said at the meeting was that if we work as one nation, there will be no scarcity of resources. He said the central government is working on all possible options to reduce the travel time and turnaround time of oxygen tankers. Railway has already started oxygen express trains. Empty oxygen tankers are also being transported by the Indian Air Force to reduce one-way travel time. And in that context, he urged all states to work together and let's coordinate with one another to fulfill requirements relating to medicines as well as oxygen. And he said that one thing he cautioned the states, that let the states check hoarding and black marketing of either oxygen or medicine. That was one very pertinent point which the Prime Minister emphasized. And he said Prime Minister was taking down notes of the Chief Minister's concerns and the points which they were raising, particularly with regard to supply of oxygen and also about the distribution of vaccines. But the Prime Minister was very clear in his mind that this fight is a continuous process. It is a continuous effort. And all concerned departments and ministries of the government are also working together. And industrial oxygen has also been diverted to meet immediate requirements of all the states as well as the hospitals, even including the private sector hospital. And fight against pandemic has to be a collective one. And as the country demonstrated during the first wave, and India did succeed during the first wave of pandemic, just because of our united efforts and united strategy. And he said the same thing we will have to do it now. We'll have to meet the challenge again, and therefore a united approach, sort of a concerted effort, collective effort on the part of all the chief ministers, states will have to be there. And the meeting was obviously virtual. And later on, after that meeting, the Prime Minister held a meeting with all the oxygen manufacturers across the country. And point which all the Chief Minister was making about uninterrupted supply of oxygen, and all the oxygen manufacturers, both public sector, private sector, they have assured the Prime Minister that the production of oxygen will be augmented to meet the requirement of the country. And because it now has become a life-saving gas, and it should not be running short in supply in hospitals across the country.
Mr. Tandon, as you said, the Prime Minister has also said that the whole nation needs to come together, and he has held meetings with the oxygen manufacturers. Since yesterday, we're seeing a lot of hospitals in the capital have been putting out these messages that they have just a few hours of oxygen left. Now, a few hours ago, there have been tweets by some hospitals. So one of the reasons that Delhi is facing is that some states, they say, are not allowing oxygen to enter the capital city. How has all this been addressed, especially because there's a lot of panic amongst people now? Not everybody requires oxygen, but oxygen is the main treatment for COVID. So what would you like to tell them? Will this issue be resolved now?
No, first of all, let me share with you a report which New Delhi's Sir Gangaram Hospital has issued a statement. And they have denied these reports as false, that patients have died due to lack of oxygen in their hospital. And Gangaram, of course, was, requesting more supply of oxygen, but they have made it clear that they have not allowed any patient to die due to lack of oxygen. And the hospital, I'm quoting from the hospital statement, that when oxygen pressure lowered in ICU beds, the hospital gave patients oxygen manually, did not let anyone die without oxygen. And now they have been assured that there will be 9,000 to 10,000 cubic meter of oxygen daily will be supplied to Gangaram Hospital. And in other hospitals also, now the supply of oxygen is being augmented, and hopefully situation will return to normal in the next couple of days. But as you very rightly said, states are concerned about the free movement of the oxygen from one state to another, and that is exactly was the purpose of Prime Minister meeting with the Chief Minister, that let's all cooperate and coordinate so that there is no interruption from one state to another state. And some of the states which are actually surplus in production of oxygen, like Orissa, they have assured that they would be supplying oxygen to the needy states. And therefore, we do hope. But the panic is not no solution. And the states also have their concern. But exactly that was the issue which was discussed today at the Chief Minister's meeting, and the Prime Minister assured them that all necessary steps are now being taken and they will continue to be taken. As I said, the oxygen manufacturers have also assured that this life-saving gas will not be in short supply. And in the next couple of days, hopefully, the situation will be normal and lives will be saved. And states also, during the first wave, all the states and civic bodies and paramedics and all our health workers, they were all working round the clock and they did succeed. And similarly now, there is a huge challenge which the country is facing. And that challenge has to be met by a collective effort. Hopefully, that the proper coordination between center and the state will help country overcome this pandemic situation, particularly the shortage of oxygen, as well as also some very important drugs.
Another issue besides oxygen that the Prime Minister has talked about is vaccination. Now we know that from May 1st onwards, the vaccination is opening in a big way, and 18 plus will also be eligible for the vaccines. What is it that the Prime Minister has told states in this regard, especially because There have been reports of shortage of vaccines. Several people are saying second dose has not been made available. How do you see this part of the puzzle evolving?
In the midst of what we are discussing, there is a very encouraging news coming in that the Drugs Controller General of India has approved emergency use of the JapanDeclares drug, which is Virafin. And this is for treatment of moderate COVID infection cases in adults. So another drug will now be available in the market. And similarly, efforts are on to bring in other vaccines which are being produced in different parts of the world. And there are assurances from companies like Pfizer that they would be manufacturing their vaccine in India and another vaccine may be available. So India still needs more vaccines. That's why the government has now allowed the hospitals, private hospitals also to purchase vaccine directly from the manufacturer. So all these measures are being taken. And if you look at the positive side of it, and daily roughly around 40 lakh people are being vaccinated, more than around 14 crore have already been vaccinated. But it's a huge country and the problem is also gigantic and the country has to face it and fight it unitedly. And let's hope that like we did succeed in the first wave, we will succeed again and situation will be brought under control, whether it's availability of vaccines or whether availability of the life-saving drugs or particularly the supply of oxygen.
Another issue that Prime Minister had earlier talked about is the lockdown strategy. Now the cases are rising. There is no sign of abatement yet. How do you think states should approach going forward? Delhi is under lockdown right now, but just for another few more days. What should be the strategy and has the PM talked about this at all today?
So if you remember, just a couple of days ago, the Prime Minister made a broadcast to the nation, particularly on the issue of curfews, which the states have been asked to enforce, particularly the night curfew, weekend curfews, and things like that. And primarily, the Prime Minister advised all the chief ministers and the states to look at the situation from their own perspective and take appropriate action and measures, which the states are doing now. And that's why we see that different states and chief ministers are taking measures according to the situation as it is developing in their respective states and area. But one thing which was very categorically emphasized by the Prime Minister was that along with saving lives of the people, we have to save the economy also. Therefore, complete lockdown should be the last resort. That is the message. But containment zones can be earmarked in each and every district, and accordingly the measures should be taken. Enforcement of the strict measures should be left to the district magistrates, and the states, depending upon the situation, they can extend the curfew, night curfew to weekend curfew. Like you said, in Delhi, beyond weekend curfew, Delhi is now having a sort of a lockdown for the entire week. So depending upon the situation, states are taking measures. They are enforcing, their law enforcing agencies are also executing these measures. And as we know, 10 states are really in the grip of very serious pandemic. And therefore, the chief ministers of these states are reviewing the situation, monitoring the situation at the ground level on a daily basis and accordingly devising measures how to deal with the situation. And therefore, the Prime Minister from time to time has been meeting the chief minister, holding internal review meetings, having meetings with all the departments of the government, including the defense forces are also now in action. And therefore, I think whatever measures India could take are already being taken and measures are also being devised. Situation is being monitored, reviewed from time to time, and accordingly, whatever is necessary hopefully will be done at all levels. But whether to go for a complete lockdown or not has been left to the states, and states accordingly are devising their own strategies.
Another important tool in this whole fight is testing, and I think Prime Minister has asked states now to ramp up testing. One of the reasons is because of why a lot of cases go undetected. What is the role of testing, Mr. Tandon, now?
I think if you look at the testing statistics, testing has been at a very massive scale going on now. But the worrying factor seems to be the positivity rate. Now, for instance, if in Delhi, if 1 lakh tests are done and 24,000 positive cases are detected, that means the positivity rate in Delhi is about 24%, which is alarming. So therefore, more tests, and if the positivity rate continues to be like that, obviously is a very grim situation. So therefore, testing has now been, I think, intensified all over the country. And along with that, the vaccination drive also is going on. It's very, very significant to note that in the midst of the pandemic, when there are so many cases coming up, around 300,000 cases per day, 2,000 deaths, even then the vaccination drive has not been hampered in any part of the country. And that, I think, is the way forward. Testing and then not only treating them and isolating them and following the SOP norms all over the country, at the same time not letting the vaccination drive slow down. I think that is the whole issue which the country has to face, and that is exactly what is being done, because any kind of panic may lead to people not going for vaccine. So that has to be checked. But ultimately what really matters is the people of the country, the people in every district, village, town, to adhere to the norms like washing hands, maintaining social distancing, and of course, mask. I think mask is the most essential part, which now people are adhering to, and the state governments are also having very strict enforcement. Fines have been announced, and people caught without mask. All these measures and SOPs are now being taken at a war footing, and there is no doubt that India will overcome this situation very soon.
We surely hope so, and we request everybody who's listening in to not panic and take care of themselves, stay safe, follow COVID-appropriate behavior, and hopefully we shall tide over this crisis very soon. Thank you so much, Mr. Tandon, for joining us today.
Thank you.
NASA successfully launched Crew 2 astronauts to the International Space Station on Friday.
10, 9, 8, 7, 6, 5, 4, 3, 2, 1, 0. Mission and liftoff. Godspeed, Endeavour and Crew 2.
Copy, 1 Alpha.
Endeavour launches once again. 4 astronauts from 3 countries on Crew 2, now making their way to the one and only International Space Station.
In a statement, NASA said that the SpaceX Crew 2 astronauts are in orbit following their early morning launch bound for the International Space Station for the second commercial cruise rotation mission aboard the microgravity laboratory.
In IPL cricket, Mumbai Indians has set a target of 132 runs for Punjab Super Kings in Chennai. In reply, Punjab Super Kings were 121 for 1 in 17.1 overs when reports last came in. Earlier, Punjab Super Kings won the toss and opted to field.
A quick look at the headlines once again. Prime Minister Narendra Modi assures full support to all the states in the fight against COVID-19. India intensifies efforts to distribute oxygen in the country. Air Force pressed into action oxygen generation plants to be imported from Germany. Japan declares state of emergency in Tokyo, Osaka regions to contain COVID-19 spike. India and the US announced Climate and Clean Energy Agenda 2030 partnership. Rescuers race against time as hunt for missing Indonesian submarine KRI Nanggala continues. NASA successfully launches Crew 2 to the International Space Station, and in IPL cricket, Punjab Kings take on Mumbai Indians in Chennai. India is celebrating the 151st birth anniversary of Mahatma Gandhi. Before we end, let us listen to his favorite bhajan Vaishnavajan by artists from Laos. And with that, we end this bulletin. We'll be back at the same time tomorrow with the next edition of World News.